Dr. Mark Stein, thank you so much for being on AM Buffalo yet again to talk about good oral health. I think the last time we talked, we were talking about teeth grinding, but you're back to talk about making sure that you get the necessary work done, because some people really put it off because of fear. Do you see that a lot?
Absolutely. Absolutely. First of all, thank you so much for having me. So, as an oral maxillofacial surgeon here in New York City, we kind of see the end stages of patients who have severe dental phobia and don't go to the dentist until it's an absolute emergency. So, I would definitely encourage patients to see their dentist regularly. We saw during the time of the pandemic, when dental offices were closed and patients were not able to see their dentist, a severe increase in dental issues, such as breaking teeth, abscesses in the mouth, certain areas that may have required a biopsy to find out that it's not something serious. Those went missed. And so at this point, we're playing a lot of catch up for patients that are trying to go back and rekindle their relationship with their dentist. Ultimately, patients shouldn't be afraid, because the earlier we detect something or the earlier that it's addressed, the easier it is to solve. Once patients arrive at an oral surgeon's office like myself, we have a lot of different ways to reduce anxiety for patients, such as administering intravenous sedation. So for the entire time that the patient has to have anything done, they're comfortably sleeping. And when they wake up, the procedure's over. And so that makes patients feel really comfortable coming to an oral surgeon who can put them at ease, take care of them, and know that there's nothing really to fear.
And being that your specialization is bone grafting and dental implants, you really can speak to the entire process and how important it is that the entire experience is soothing for the patient. What steps did you take, as an example for other dentists, perhaps, in making sure that the entire experience is one that is, or rather can ease fears?
So we often spend a lot of time educating our dental colleagues as to what options are available when they come to the oral surgeon. Patients know that from the minute they come into our office, our entire staff is involved in really the patient experience process. So patients have a lot of anxieties, patients have a lot of fears. They're coming in with potentially some discomfort or an abscess or something that needs to be done in an invasive type of way. They know that all they're going to feel is a slight little pinch in their arm when we administer the medication. Afterwards, they're fully monitored, so we make sure that their vital signs are fully stable during the entire procedure. And that may involve removing a tooth, placing a bone graft in preparation to replace the tooth with a dental implant. And even for dental implants, the patient is usually sedated for all our procedures, and so they have nothing really to fear, and they know that they're in good hands and will be taken care of comfortably.
I think a big worry for a lot of folks is that it's a long, drawn-out process. Like they think, oh, I waited so long, so it's not just one tooth that I have to get fixed. They're thinking, I have to get 2 or 3, or, oh, God forbid, your whole mouth needs work. And they're thinking, this is going to take forever. I'll be back in and out of the dentist's office. But you have reassurances, I guess you could tell folks, this can all be done in one day, perhaps?
Yes. So there have been a lot of advances that have been made in the area of dental implant and tooth replacement. For patients that have a lot of teeth that need removal and replacement, we have techniques where we can treat all those teeth in one session under sedation. So within 2 or 3 hours, with a lot of planning in the background, we can remove the patient's non-healthy teeth, place dental implants, and then with the assistance of our restorative dental colleagues, insert teeth on those implants the same day. So it's truly a life-changing experience for patients that have been afraid to go, didn't really know what to expect or how long it would take. They come in, and a few hours later, they leave with a brand new smile. It's really reassuring, and we're so happy to be able to change patients' lives in this way.
In case there are folks out there who are thinking, I need more information and I'd like to do my own research, can they check out your website to see the work that you've done in the past to see if that works for them?
That's a wonderful idea. We have a very, very comprehensive website. It's www.nyoralsurge.com, or they can just Google my name, Mark Stein, DDS, MD. We have a lot of before and after pictures. We have a lot of videos where I explain how dental implants are done or how other surgical procedures are done. So it's a really comprehensive website. I encourage anyone who's interested in oral surgery, dental implants, or dentistry in general to visit our website.